Having a vaginal discharge is a completely normal thing. Again, vaginal discharge has functions like cleaning your vagina and preventing it from getting infections. Most of the time, our vaginal discharge can be a sign that something is wrong down there. But again, how will you know that there is something wrong down there by just observing your vaginal discharge? There are several things that will show you that this kind of vaginal discharge is not okay. Welcome to the Nursing Moms, and it's me here, Nurse Janet. In this video here today, I'm going to talk about the different types of vaginal discharges, the different types of colors, and what could each and every color could possibly mean. Stay tuned and watch to the end. Before we move to the abnormal vaginal discharges, do you have an idea of how a normal vaginal discharge should be? Okay, let's move to the normal vaginal discharges. This normal vaginal discharge depends on different things. Depends on your age. It depends whether you're pregnant or not. It depends on the time of your menstrual cycle. Again, it depends whether you are breastfeeding or using any contraceptive method. Have you ever asked yourself why there is always a yellow discoloration under your pants, or that bleaching part just under your pants? Yes, the vaginal discharge is acidic, and that acid bleaches your panties. Another thing, that the vaginal discharge, the normal one, should not have any smell. The normal vaginal discharge can vary from being white to cream or even to being transparent. A normal vaginal discharge should not be accompanied by itching or even any burning sensation. A normal vaginal discharge can be thick to stretchy. It's always thick after ovulation. But again, towards your ovulation, you can realize that the normal vaginal discharge is always very stretchy. This is just a mother nature to help the sperm swim swiftly upwards to meet an egg. How are you going to know that this vaginal discharge is not okay and you should see a doctor? What are you going to observe? First thing, we have to know that color change. We have to check on the smell. If it presents with any itching. Again, if it's suddenly too much, you know the amount of the vaginal discharge that you should be receiving. If at all there is sudden increase in your vaginal discharge, if at all there is no vaginal discharge, that should be alarming. Again, another thing we are going to observe to know that everything is not okay is if we have any pain on the pelvic region. That means it's not okay. Without much wasting time, let's move to the different vaginal types and colors. To begin with, let's start with the white vaginal discharge. This can be very normal at any time of the cycle. The white vaginal discharge is a normal color of a normal vaginal discharge. But again, if it presents with a cheese or curdled milk, and it presents with itching, then you should see a doctor. This can be an indication that you have a yeast or fungal infection. You should see a doctor, and it's treatable. It's not a sexually transmitted infection. It's just a change in your vaginal pH, and the fungus invades and starts multiplying, causing an infection that you just want to scratch yourself. The yellow or green vaginal discharge, especially when it's chunky and thick with a foul smell, then it can be an indication that you are having a sexually transmitted infection. A sexually transmitted infection that is less recognized compared to other sexually transmitted infections like syphilis, gonorrhea, and all that. This disease is known as the trichomoniasis. It's asymptomatic in nature. Apart from the vaginal discharge, you might not be experiencing any other symptoms. And this is why it spreads, because you might be having it. And again, you have a sexual partner that has a sexual partner that has a sexual partner. The cycle can be too large, and you're not treating this infection. What do you expect? It will keep on spreading and spreading and spreading. So if you experience any of these symptoms, you have to take the guidelines of treating a sexually transmitted infections. You have to get treated. Use condoms when you have to have sex. Another reason for having a yellow discharge, especially when it's thick or frothy, accompanied with burning sensation while passing urine, or having a very low abdominal pain, and again it can have unpleasant smell. This can be a sign that you have gonorrhea, another sexually transmitted infection. You have to visit your doctor and they have to do tests to identify the causative organism of this sexually transmitted infection. If it's gonorrhea, there is treatment. Just follow the guidelines of treating sexually transmitted infections. The gray or white vaginal discharge, it can be grayish or whitish, but with a very distinctive smell. The fishy smell vaginal discharge. If you realize that your vaginal discharge is smelling like a fish, oh, you have an infection. The infection is known as bacterial vaginosis. It's caused by change in the vaginal pH, leading to an overgrowth of bacteria and causing an infection. It's treatable, and you just have to visit your doctor to get treated. The brown vaginal discharge. This is also a normal vaginal discharge, especially if you are just about to get your menses, or or it can occur after getting your menses, those few days that you're now clearing your menses. But again, it should not occur in between your cycle. It's something different. Then you'll need to go and see your doctor. Don't confuse a brown discharge with spotting. Spotting is a bit different. It can be bloody or even brown. The red vaginal discharge. If you experience this just few days to your periods, it's normal. If you experience it after periods, again, it's normal. But if you experience it in between your menstrual cycle, again, if you experience it like you having the normal color of the discharge, but again with a tinge of blood in it, then this is not normal. It shows that there's some cervical abnormalities. It can be cervicitis, it can be the precancerous conditions of the cervix. You need to go and see the doctor for further investigations. If you experience any blood taint in your normal vaginal discharge, it can be accompanied by bleeding after coitus. It can be accompanied by lower abdominal pain. You have to go and see the doctor as early as you can. The clear, stretchy vaginal discharge. This is one of the most normal vaginal discharge. Again, being clear or stretchy depends on the time of your menstrual cycle. If it's towards ovulation, you realize that the vaginal discharge becomes more and more stretchy. This is just a mother nature in order to help the sperm swim upwards to meet your egg. Again, after ovulation, realize that it becomes a bit thick. Yeah, this is a normal vaginal discharge.
Welcome to the Nursing Moms. If you like our videos, hit the like button and subscribe. Stay updated for more coming videos by hitting the notification bell.